Intro. So, you're pregnant. Congratulations. And now the questions begin, starting with, how many times will I actually get to see my baby on an ultrasound? You might be picturing a handful of appointments, but the real number, whether it's just 2 or more than 5, is totally unique to your pregnancy. We are going to cover the standard ultrasound playbook, why your doctor might call for a few extras, and what they're really looking for in them. Section 1. The standard ultrasound schedule. For most healthy, low-risk pregnancies, the magic number is usually 2. Some doctors might add a third later on to check on growth, but 2 is the classic combo, and they're timed perfectly to check in on major milestones. Your first peak is usually the dating scan, which typically happens in the first trimester, somewhere between 8 and 14 weeks. The goals here are to confirm the pregnancy with that very first flutter of a heartbeat, give you a solid due date, and see if you're carrying one baby or maybe more. Because your baby is still so tiny, this is often a transvaginal ultrasound. That just means they use a small wand-like tool to get a much clearer picture than they could from on top of your belly. Next up is the one everyone gets excited about, the anatomy scan. This detailed exam happens mid-pregnancy, between 18 and 22 weeks. Think of it like a full, head-to-toe inspection of your baby. A technician will carefully check the baby's brain, heart, spine, and all their major organs to make sure everything is developing on track. They'll also look at your placenta's health and the amount of amniotic fluid. Section 2. Why you might need more scans. So, what if your doctor starts talking about more than 2 scans? Don't panic. This usually just means your pregnancy has been labeled high risk, which sounds a lot scarier than it often is. It's basically a catch-all term for any situation that needs a little extra TLC. This could be for all sorts of reasons. If you are expecting twins or triplets, you'll definitely get more scans to watch each baby's growth. Other factors can include being over 35, having a health condition like high blood pressure or diabetes, or if you had complications during a past pregnancy. Think of these extra scans, often called growth scans, as bonus check-ins. They aren't a red flag that something's wrong. They're just a tool your healthcare team uses to make sure your baby is growing steadily, check their position as you get closer to delivery, and keep an eye on the placenta and fluid levels. It's all about being proactive, not reactive. Section 3. Other types of ultrasounds. Now, besides the main 2, there are a couple of other scans you might hear about. Between 11 and 13 weeks, some people are offered a nuchal translucency, or NT scan. It's a special screening tool that measures the fluid at the back of the baby's neck to help assess the risk for certain chromosomal conditions, and it's often done with a blood test. And of course, you've probably seen those incredible, almost lifelike 3D and 4D ultrasound photos. These are usually elective, which is code for not medically necessary, and likely not covered by your insurance. While those keepsake images are amazing, major medical groups like the FDA and the American College of Obstetricians and Gynecologists discourage getting an ultrasound just for entertainment. The big worry is that the person at a keepsake studio isn't trained to spot medical problems, which could give you a false sense of security or, worse, miss something important. Section 4. Are ultrasounds safe? Okay, let's talk about the big question on every parent's mind. Are all these ultrasounds actually safe? The answer, backed by decades of research, is a resounding yes. When performed by a trained professional for medical reasons, it's considered a very safe procedure. Unlike X-rays, ultrasounds don't use any radiation. They use high-frequency sound waves to create an image, and there's no evidence this is harmful to a developing baby. Medical professionals follow a principle called ALARA, which stands for as low as reasonably achievable. Basically, it means they use the lowest possible power for the shortest time needed to get the medical information they need. Safety first, always. CTA. If this helped you feel a little more prepared for your pregnancy journey, hit that subscribe button for more videos just like this. And we'd love to hear from you in the comments. How many ultrasounds did you have, or are you expecting to have? Conclusion. So, the bottom line is this: while most healthy pregnancies have two main ultrasounds, the dating scan and the anatomy scan, your personal schedule is tailored to you. Having more scans doesn't mean more worry. It's simply your healthcare team using an important tool for extra monitoring to keep you and your baby safe. Every pregnancy is unique, so the best thing you can do is keep talking with your doctor or midwife. They're your best guide through this whole amazing process. Thanks for watching, and we'll see you next time.